When is a concussion considered chronic? There's actually two main diagnostic criteria for this. One is actually from the DSM, and this one is version 4. We're currently on DSM version 5, and they've actually removed post-concussion syndrome from their diagnostic criteria, but nonetheless, the DSM-4 criteria often gets used, and what that is having 3 or more concussion symptoms beyond 3 months from the injury. So that's the DSM-4 criteria, is 3 months after injury still having symptoms. The other one is the Icd-10 criteria, so that's the International Classification of Diseases, version 10, and that one is 4 weeks. So that one is having concussion symptoms, 3 or more concussion symptoms, and they categorize them, so there's like sleep category, there's different categories of the symptoms, but basically it's 3 or more symptoms at 4 weeks or greater from injury. Now the question is, which one of these classification systems do you use? We use the Icd-10 criteria, and I'll tell you why. After concussion, well, concussion causes an energy deficit within the brain. Most of the evidence in humans has found that that lasts anywhere from 3 to 4 weeks. So that's kind of the metabolic recovery time zone for humans as far as we know anyway. Beyond that period, we don't really have a good clear explanation as to why people are having ongoing symptoms, and it could come from any one of kind of the 5 categories of persistent concussion symptoms. Some people say 6. We just go with 5 because we've condensed some categories, but it kind of fits with the timeline with the 4 weeks. So the way that Berlin has structured it actually is that they've considered symptoms to be persistent. So they're calling it now, rather than post-concussion syndrome, the terminology has kind of changed. So the new terminology is persistent symptoms. And Berlin, which is the international consensus statement, considers symptoms to be persistent in adults at 14 days after injury, and in children at 4 weeks after injury. So that kind of fits with the Icd-10 criteria. So technically, in my mind, you're not considered chronic by definition until 4 weeks, but we start treating you as if you are chronic at 14 days, and in some cases even earlier now. So for example, doing exercise testing, treadmill testing, vestibular and ocular motor rehab, and then starting in with treatment of the neck and getting you on a diet plan. I think we start that as early as 10 to 14 days, because if we don't, well, you're going to just continue down the chronic path anyway, and we're going to see you at week 4, and you're still going to be symptomatic. And so generally we have these 2 kind of camps where your symptoms are gone in the first 10 days, and your recovery is quite speedy. But if your symptoms are still there at day 10, then we kind of start intervening at that point. So kind of a convoluted answer. By definition, it's 4 weeks. Clinically, we start treating it as if you're chronic at 10 to 14 days.